Hello there. Welcome once again to Masters of Industry. My name is Emmanuel Abara Benson. On today's episode, we spoke to the Chief Executive Officer of Avon Healthcare, Mrs Adesimbo Ukiri. She talked about a whole lot of issues pertaining to the health insurance industry in Nigeria, including what the company is doing differently from the competitors. Enjoy the conversation. Can you tell us a little bit about yourself and your background prior to this time?
My pleasure. Thank you for coming in. My background. I was initially trained as a lawyer. So first degrees in law, went to law school. I also have a master's in management from London Business School. But my background is pretty diverse. I've worked in the financial sector, in banking. I've worked in manufacturing as well, fast-moving consumer goods. I've also worked in telecoms. I've worked in oil and gas a bit. And then finally in healthcare. But I think healthcare is the one I love the most. That's where I've been for the past more than 10, actually more like 13 years now. So yeah, interesting background.
So what is it about healthcare that is so interesting?
I think healthcare, because in Nigeria, it's a sector that still needs so much done. It's a sector that has so much opportunity and so much room within which to make an impact. And if you are the kind of person that you like to work in the sector in which your impact can be felt immediately, and you get a thrill from seeing the impact you're having almost immediately, healthcare is the sector for you. Because you see the good you're having on a daily basis, you almost get a hit from the good you're doing. And that's why working in the health sector for me has almost become like addictive, because you see the change you're making and you see it touching people's life on a personal basis. It's almost a daily thing, the impact you have.
Can you tell us a little bit about Avon Healthcare and what you guys are doing differently from the competitors?
Okay, so we started off as a business we got a license in 2012, but we actually opened our doors to the public in 2013. So we've been around now for about 9 years. And over that period, we came into the market determined to do things quite differently. Prior to that, the Nigerians didn't really trust HMOs. HMOs had a really bad reputation for being people who took money, never paid hospitals. Services were not trusted. And we really wanted, health cover, health insurance, health management services to be something that Nigerians would embrace, and something that the average Nigerian would plan for and budget for, more or less the same way they kept money aside for their rent, they kept money aside for education. They would also keep money aside and say, this is towards a health cover for my family. And that's something that we hope we've been able to, have an impact on in the minds of Nigerians over the past 9 years. We've seen the trust grow, definitely, and we've seen more and more people becoming aware of what taking out a health cover can do for their pockets as well as for their health. What sets us apart? We are not a financial services company. You see many other players in the market who are health insurance companies. They very much see themselves as offering a financial product. We're much more than that. What we offer is, yes, we offer financial access to healthcare services, but as much as what we offer is partly a financial access, what we're also offering is quality healthcare services, as well as the financial access with which to have it when you need it. So we see ourselves as a partner to you. You being either a corporate organization, a group of people, the head of a family, or an individual, in looking after your health and in ensuring that you're having a healthy, fuller life by reason of your partnering with us. And we see it as our responsibility to empower you. So that's why we are very heavily focused on preventive health. We're very focused on educating you. So we're not only providing you with a cover that takes care of you should the unforeseeable happen to you health-wise, We're also very big on telling you what to do, what not to do, how not to do, in order for us both to ensure that you're healthy.
Which is very important.
Very important, yeah.
So last year, the COVID-19 pandemic affected so many people. Some businesses were also affected, like different sectors of the economy. So I've always wanted to ask, how did it affect those in the HMO space? Because I know you guys must have paid so much, you paid out some claims and everything. How exactly did it affect your operations?
It was a tough period for us. And I look at it from two perspectives. I look at it from us internally as a company, like any other company. So we all had to adjust to the new way of working. There was this lockdown, staff couldn't come to the office, they had to work remotely. And that had its own effect on, the emotional and mental well-being of our staff. It also had its effect on operations because suddenly our call center had to work remotely. The nurses and doctors who, prior to now, could case manage the members who were on admissions in hospitals, go to the hospital, see them, provide some support, oversight over the treatments they were receiving, couldn't really do that anymore. The client managers who used to be able to go to client offices, give health talks on client premises, provide on-the-spot health checks to clients, etc., etc. All these activities that we used to carry out, we couldn't really do those the way we used to do them anymore. So it affected us in that sense, and the sense of, communal bonding that gave to us as a company really wasn't there anymore. So we all found ways to cope for business to continue, and we found ways to start supporting ourselves and to support each other so that, the effect on our mental and emotional health wasn't too adverse. But what it did was I opened our eyes to see that if we were going through this, then our clients were definitely also going through this as well. And it made us also start thinking of ways in which we could support our clients. And we started a series of webinars around emotional wellness, mental wellness, and coping with COVID. And that became something else that clients really, really appreciated. So a lot of the services we were providing physically on premises, we shifted to providing it online through virtual means to many of our clients. Throughout the period as well, because many people were very wary of going to hospitals, we then started the Avon online doctors, where you would call into our call center and then be able to have consultations with our doctors online who would also treat you. And because we already had relationships with diagnostic centers and with pharmacists, who we could always find one that was near enough you in our network where you could go in and do some blood work or they take samples of you. And those results could be submitted electronically to our doctors. Your drugs could also be delivered to you at home. And we had to invest also in some infrastructure, which we didn't have before, to enable this ecosystem, this virtual ecosystem come alive for a lot of our enrolled members at no added costs to them, if I may say so, So these were some of the things we had to grapple with during the COVID period of the lockdown. But it has opened our eyes to new ways in which to engage with and in which to serve the clients and the members that we have. And hopefully as a society, we'll continue to learn from this and evolve.
What would you say is the biggest challenge facing the HMO industry in Nigeria?
I'd say it's education and awareness. But that is rapidly changing. The average Nigerian, some people would argue with that and say it's more of a disposable income issue. That people, do they even have enough money to eat? There's such a large proportion of our population living at poverty or below poverty. And, health is not something that is very high. But then you look at the amount of money that is spent on telecoms and airtime and data, for instance, and you also look at the amount of money that is spent on beverages, on alcoholic beverages in this country. And then it makes you wonder that really and truly, people can afford to spend more on health. And so the question then is, what do we prioritize and how do we educate the population to be aware that health is something that you should set money aside for and you should contribute into a pool that would go towards looking after you if and when you fall ill. Because at some point or the other, each person is going to need it. So you shouldn't resent the fact that actually you're not ill for a while and other people are using what you've contributed, because the day you fall ill and need it, you'll be using what other people also contributed. So I think that's the greatest challenge.
So how are you changing that perspective? Because some startups, most startups in Nigeria don't offer HMO to their employees, and the reason is always that they don't have enough money to do that. So how do you change that mindset? Because like you said, this HMO is very, very important for everybody.
Yeah. I mean, we're doing what we can. We're very active on all the social media channels. We also do quite a bit of advertising on radio in particular. And we believe that it's just a matter of time. We're focused more on the young upcoming professionals as well, because we believe that they are the ones who are mostly internet savvy. They are the ones whose minds can be changed. You know, they are the ones who are most open to these ideas, and they are the future, really and truly. So this is where a lot of our investment in education, in awareness is going. And we believe that the tides are shifting in our favor.
Okay. So just a follow-up question to that. A lot of Nigerians don't have insurance, health insurance packages. And like you mentioned, it's always about the cost. Now, when you look at it, actually, some people really don't have enough money to put aside in case anything happens. It's always when something happens that they will start running around looking for money. So do you have packages that are affordable to such people?
Yeah, indeed. I mean, we have packages that go for as low as 20,000 naira for the entire year. Divided by 12, what's that? That's less than, how much is that? If you do 2,000 naira a month, that's 24,000 naira for the whole year. Even if you went through it, and it's also accessible through third parties who allow you to pay monthly. And then, so instead of paying 1,500 per month, you pay something a little bit more. But at 1,500 per month, you can subscribe to a health insurance plan.
Now, what would that cover? Like if somebody falls ill,
what would that cover? That would cover you for your general, what we call GOP services, so general outpatient services. You have malaria, you have typhoid, you have upper respiratory infections, all your normal, I'm feeling ill, I need to go to the hospital. That would cover it. That would also cover your normal everyday surgeries like appendectomy, hernia, you need to have a wound sutured, a simple fracture, admission in the hospital for a number of days. You know, things that normally you would spend up to 100,000, 80,000, 70,000, 50,000 for. That would cover you for it. So, you know, think about what you've paid and think about the limit to which you are covered for.
Wow, that's fantastic. Regular people like us can do that.
Definitely. Definitely.
So let's talk about you for a moment. What has the experience been like since you started working here?
It's been interesting. Like I said, we started in 2012. The company opens its doors to subscribers, to enrolled members in 2013. And initially, there was myself and 3 other people. Then we grew from 4 people to 10 people, from 10 people to 20 people, from 20 people, 50 people. Now we're by 100 people. And we've continued to grow. Now we have enrollees across all the states of the Federation. We're everywhere. You know, a startup is never easy in the beginning, but it's very fulfilling when you look back over the years and you can see how the contribution of everyone who's ever been a part of this journey has had such an impact. And the gratitude you feel is not just for what the company is today, but for the people who have been a part of the journey with you and how much of a blessing it has been to have them make that journey together with you.
So in Nigeria, we don't have, Nigeria and Africa as a whole, as a matter of fact, we don't have so many women occupying positions like yourself, but there are so many young ladies that are aspiring to be like you, although circumstances are always trying to hinder them. What advice would you give such people?
What I'd like to say to young ladies, young girls, is that you've just got to believe in yourself and believe that there are actually no limits. The first requirement is to believe in yourself and to believe that everything you desire and you want is possible. Not only is it possible, you have to believe that it is going to be, because it is what you desire. And that it is within your right, it is within your prerogative to have that desire. Nothing is too big for you to dream. Nobody should be in a position to tell you what you're aspiring for is beyond you or too big for you. Don't ever allow those kind of thoughts to be in your space. Whatever it is that you have dreamed or you're dreaming of, whatever it is that occurred to you as a vision of yourself is utterly valid and is utterly doable. Just work towards it. And, I also like to say to them that be prepared to pay the price. And pay the price is just work for it. The price is work. There's no other price. God will bless your work, but you have to put in the work.
So how has the company been performing financially? Could you tell us a little bit about that?
Yeah, I'm very pleased with our financial performance, and I'm glad to say that whichever way you look at it, we will be counted as one of the top 3 in the industry today. And we met quite a number of players in the industry when we started, who had been around for up to 10 years or more before we came into the picture. And to be able to be where we are today is a testament to the people of Avon and to the customers and members who continue to put their trust in us and who continue to believe in us, and the partners we have in the hospitals as well. Because every day is not a rosy day. There are days when systems have issues. There are days when things don't work out the way they do. But when you have partners who believe in you, and when you tell them that, look, I'm sorry this has happened, but believe that we will work through this and we will rectify it. And they give you the chance to do so because they know you and they know that, look, this company have said they will fix it and they will fix it within the time they've committed. And they're prepared to wait that time out and watch you fix it. That's something you really can't buy. Money can't buy you that kind of belief and that kind of trust. So I'm really grateful to all of them. And time again, we earn that trust.
So, final question. What are your growth projections for the year and going forward?
It's been tough. And the market is only getting tougher. Because as you know, the economy has taken a bashing from COVID. Globally, the economy is taking a bashing. But our industry continues to get even more competitive. There are new entrants that are coming this year. There's a war on talent. The good people in this industry are not very many. And now, there's more of a demand for good people as well. And this industry also continues to have players who do not play by the rules, players whose books are not the way they should be, who cut corners, who do damage to our respective standing in the eyes of the community, in the eyes of the Nigerian populace, who erode the trust that we are trying to build. So it's a very tough environment in which to operate. But we are hopeful. We have a regulator who, again, in the past few years, that, the new regulator has been, has taken over the mantle, has continued and consistently shown signs of trying to sanitize the industry and push for growth. We also have hope in the new legislation that is going to be passed to make health insurance compulsory for all employers. So there are signs that things will get better for us in this sector. And when things get better for us in this sector, it augurs well for the entire healthcare ecosystem, because what our sector does is that it guarantees hospitals and other healthcare facilities a steady, predictable source of revenue, so that they can predict the income that comes to them, so they can attract funding, so they can invest more. And then we have a healthcare system that actually works.
Do you have any last comments?
Go get a health plan.